Covers the information you read in your workbook about medication administration.
You play a very important role in administering medication to the clients you work with. You will be the key person to watch for side effects and to take action early.
We also need to know what to do if a client refuses to take a medication or if we discover an error has been made.
First, let's talk about the different types of medication. A medication is defined in your workbook as any compound that changes the chemical activity within the human body.
There are two types of medication, legend drugs and non-legend drugs. Virtually all of the medications found here are considered over-the-counter or non-legend, which means that anyone can buy them without a prescription. Lozenges for sore throats, cough syrup, aspirin, antacid, even vitamins, naturopathic remedies, and nutritional supplements are considered non-legend medications.
Prescription medications can only be obtained with an order from an authorized healthcare provider. Doctors, physician's assistants, nurse practitioners, or dentists. Prescriptions come with specific instructions for use.
Hi.
Hi, we're here to pick up a prescription of diazepam for Earl Smith.
Okay, I'll be right with you.
Oh, she's with me.
Okay, good. Earl Smith, sure, just a couple of minutes.
So if a client complains of a headache, can I just give them a medication like Tylenol?
You cannot administer any medication, legend or non-legend, without delegation from the RN.
Yet the client may have a PRN or as-needed prescription of Tylenol for headaches. Then I can administer the medication as a delegated task?
Exactly.
Many of the clients we work with can take their own medications.
If a client can take their medication independently or only with some reminders, then you won't have a delegation order.
Okay, here we are. And that'll be on your master card.
Wait, didn't you need diazepam for Earl? This says Valiant.
All medications have more than one name. There's the generic name, in this case diazepam, and the product name, Valiant.
Sure can get confusing.
Well, a generic name is a name given by the manufacturer before it's been approved by the FDA. The generic name gives some information about the chemical makeup of the medication. Now, a product name is the brand name that's used by a specific manufacturer. For example, ibuprofen is the generic name for Motrin and Advil. They're basically the same thing.
Tylenol is acetaminophen. So if I look through all those bottles over there and everything that says acetaminophen is the same as Tylenol, right?
They might be. However, there could be differences in strength, or the acetaminophen could be mixed with other compounds to make it something different.
That's why it's so important that when the RN delegates medication administration to you, that you both agree on what name you'll call the medication.
Seems like a good idea to use the name on the bottle for the medication administration record, or MAR.
Anything to prevent medication errors.
Aren't there a lot of rules or laws about medications?
Yes, there are a number of different federal laws and standards that are designed to protect the public. Now, for instance, the government defines a certain class of drugs as controlled substances. Now, a law called the Comprehensive Medications Abuse Prevention and Control Act of 1970 defines medications that are dangerous or have a high potential for abuse as controlled substances.
Such as narcotics and depressants.
Right, and also stimulants and psychotropic medications. I mean, due to the risk of abuse, well, these medications have controls placed on their use.
What can nursing assistants do with controlled substances?
The RN can delegate administration of controlled substance medications to a nursing assistant.
Why would a healthcare professional prescribe a narcotic or psychotropic drug anyway?
Well, essentially, medications are meant to do one of three things: treat, cure, or control an illness, relieve symptoms like pain, and prevent disease. Now, narcotics are often used for pain control, and a psychotropic drug might be used for a person experiencing mental health problems, like hallucinations.
Medications work by interacting with the cells in the body and changing the way the cells work. But people aren't exactly alike, and no medication will affect the human body in exactly the same way.
That's right. I remember there are 6 things that can affect how a person will react to a given medication. Their sex, age, size, genetics, and physical and emotional condition.
Other factors might also affect the response to a medication. The route of administration, the time of day, the number given, and the size of the dose. Environmental conditions, like the temperature outside or being in a noisy room, can also affect the response.
Exactly. And another thing to remember is that most medications have other unintended side effects on the body.
Isn't it true that older people are more likely to have side effects?
People who have multiple diseases or take multiple medications are more likely to have side effects. That's something their healthcare professional should consider when ordering their medications.
It's true that when two or more medications are taken at the same time, well, they can interact with each other. Now, this medication interaction can cause unwanted side effects, or the effects of the medication may be altered.
Okay, now let me make sure I've got this. A side effect is an unintended effect of a medication, like dizziness, nausea, and headaches. But a medication interaction is when two medications are given that interact with each other in such a way as to alter their intended effect.
That's it.
So the more medications, the more likely they'll experience some side effects and possible medication interactions.
The prescribing professional needs to know all the medications the client is taking, including over-the-counter medications and supplements. They'll want to minimize the potential side effects, and the more medications the client is taking, the greater chance for side effects.
There are a large number of common side effects from medication use. Some are listed in the workbook, but other resources are physician's desk references, or PDRs, information packets that come with the medication, your RN,
Or your pharmacist.
It's a good idea to review medication administration with the delegating RN before you begin.
There are 7 routes of medication administration. Oral medications are taken by mouth and swallowed. Sublingual administration means placing a medication under the tongue.
Topical administration is applying a medication directly to the skin or mucous membrane.
Rectal administration is inserting the medication into the rectum in the form of a suppository. Vaginal administration is inserting the medication into the vagina in the form of a cream, foam, tablet, or suppository.
Medication administered through inhalation is sprayed or inhaled into the nose, throat, and lungs.
And finally, medications can be injected by piercing the skin with a needle.
Before we move on, we want to make sure you understand the difference between medication assistance and medication administration. These terms are very similar and can be confusing, so pay close attention.
Medication assistance does not need to be delegated. In medication assistance, you are helping the client only to the extent necessary for them to take their medications. This video is not about assistance. We will focus on medication administration. Medication administration must be delegated. The RN will use professional judgment to decide when medication administration should be delegated. With medication administration, you are giving the client their meds.
In your job, you will do both medication assistance and medication administration, and they can sometimes look similar. Let's join Kelly, a nursing assistant, in the medication room of an assisted living facility. She's preparing medicine for Mrs. Johnson. As you can see, medications can be packaged in a variety of ways. There are vials, bubble packs, medication organizers, and unit dose packages. Whatever the packaging, there are some important pieces of information that should be on every container. The client name, the medication name, the route of administration, the dose, the schedule, and the expiration date.
There are 5 rights of medication administration. The first is right client. If Kelly didn't know Mrs. Johnson, she would need to check to make sure she has the right person. Next, she always needs to check to make sure it's the right medication. Make sure that you give medications only from labeled containers. You should read the label 3 times, as you take it from the shelf or drawer, as you measure it, and then again as you put it away. Right dosage. You should familiarize yourself with the correct dosage symbols and abbreviations. Always use properly marked measuring containers, double-checking the dosage as you go. Right route. You should always check the route on the medication instructions. The right time. You should know the correct abbreviations for times of administration. Check the medication instructions for the correct time. You should always try to give the medication as close as possible to the stated time. Mrs. Brown is sometimes confused and not aware that she is taking medications, so the nursing assistant has been delegated the task of making sure that Mrs. Brown gets her medication correctly. She is performing medication administration. The client should be sitting up to take the medication. Then offer them a full glass of water, provided they are not on fluid restriction. Stay with the client until they have taken the full dosage. Sometimes a person is physically unable to administer their own medications. Mr. Martin has a rash and needs to put a prescribed ointment on his back. However, he has had a stroke and can't reach the areas that need the medication. So the RN has delegated this nursing assistant the task of applying ointment to his back. Again, the NA is performing medication administration because she is actually applying the medication to Mr. Martin's back.
It's 4 o'clock, time for Mrs. Wykowski's meds.
Kelly provides medication assistance to Mrs. Wykowski. Remember, assistance is when you only help someone enough so they can take their own medication. Mrs. Wykowski is aware of her medications and is able to put the pills in her mouth, but has trouble opening her prescription bottles. Again, medication assistance does not need to be delegated.
Mrs. Wykowski doesn't need someone to administer the meds for her. She can do that herself. So in this instance, Kelly is simply providing assistance with self-administration, and that does not need to be delegated to Kelly. There's a whole list of the differences between medication assistance and medication administration in your workbook.
An RN must delegate medication administration. 2 situations that may require medication administration are the resident may not be aware of taking a medication, or the resident is unable to put the medication in their mouth or apply it to their body.
Okay, let's review the basic steps of medication administration. Step 1 is evaluate the client before you give the medication. Trust your judgment and contact the RN if you are uncomfortable or have any doubts about administering the medication.
If you observe a significant change in the client's health or you have any doubts about the 5 rights, do not administer medication and call the RN.
Step 2 is setup. Kelly prepares herself by focusing solely on the task at hand. Washing with soap and water is the most effective way to prevent the spread of germs.
Notice how Kelly keeps her working area clean and neatly arranged, and she only prepares medication for 1 client at a time. She double checks herself using the 5 rights: client, time, medication, dosage, and route. Kelly is careful not to touch the medication and only gives the medication from labeled containers.
Bubble packs are sealed until you are ready to give them. When you pour medication from a bottle, pour to the side away from the label. You want to keep the label free from drips. Recap the bottle tightly before restoring it. You only crush, cut, or mix medication with food if the delegating RN has given you instruction to do so.
If you notice anything unusual about the medication, do not give it to the client. Instead, call the delegating nurse.
The third step is to administer the medication. Be sure to follow the written instructions for your client provided by the delegating RN. Step 4 is to document the medication administration. Your delegating RN will provide you with specific written instructions on how you should document your completion of the delegated task.
As a general rule, you should document administration of medication right after you've given it. You can use initials on the administration record, but always sign your full name somewhere on the record.
Always document medication refusals, errors, or the administration of a PRN medication.
Step 5 is observe. After you've administered medication, you should watch the client for any side effects and interactions. Medications should be stored in original containers with the legible original label. Non-refrigerated medications should be kept in a dry place, not warmer than 85 degrees. All prescription and over-the-counter medications should be kept in locked storage in a facility.
Refrigerated medications should be stored at 35 to 50 degrees Fahrenheit. It is safest to keep refrigerated medication in a Ziploc-style plastic bag or other non-leaking container. Be sure to separate medication storage from food storage.
Medications need to be disposed of when they are discontinued or if the client is no longer in the home or facility. Check the policy where you work to know what your responsibilities for disposal are.
I ask the client or their representative how they would like the medication disposed of. If the client or their representative don't want the medication, then you and a witness should destroy it. Remember that whenever you dispose of medications in a facility, fill out a medication disposition form signed by you and a witness.
A medication error has occurred if any of the rights are wrong: time, medication, person, dose, or route. Following the procedure and the 5 rights will minimize errors. But if you do discover an error, report it as soon as possible. Do not try to correct the mistake on your own. Your supervisor or delegating RN should have established in-house procedures on what steps to take should an error occur.
Sometimes a client refuses to take a medication. People do have the right to refuse treatment, which includes medication. In addition, we all have a right to privacy. As a caregiver, you should work to ensure that you protect these rights.
That said, if you have a client refuse a medication, try to find out why they're refusing to take it. Clients might resist taking medications for a variety of reasons. It tastes bad, unpleasant side effects, lack of understanding, or denial of a need for it.
Talk to the delegating RN about the resistance and find out if there's anything they can do to help. That about covers it for medication administration. Thanks, Kelly.
Thanks, Kelly. See you soon.
Last one.
In this lesson, we will demonstrate a few of the procedures you might be delegated.
As with all the delegations, be sure to go over the procedures with your delegating RN. Each client has different needs, so procedures will vary from person to person.
Let's start out with the easy stuff, like eye drops.
As with any procedure, the first step is to evaluate the client. Talk to them about what you're going to do. Ask them how they're doing and see if they're experiencing any changes in their condition.
If the client has more than one eye medication, explain to them that you will need to give the medications at least 5 minutes apart.
Step 2 is prepare for the procedure. This is done by first reviewing the delegation instructions and the medication record. Wash your hands thoroughly with soap and water. Take the time to dry your hands thoroughly as well. Put on a fresh pair of gloves and prepare the necessary supplies.
Assist the client to a comfortable position, either sitting or lying down. For safety's sake, do not administer the medication with the client standing.
Clean the eyelid and the eyelashes using a clean, warm washcloth. When cleaning the eye, wipe outward, starting from the area closest to the nose. Step 3 is completion of the procedure. Give the client a dry, absorbent tissue, and to keep them from blinking, ask them to look up toward the ceiling. Place your thumb or fingers on the client's cheekbone, just below the eye. Gently draw down the skin on the cheek. Approach the eye from the side and instill the correct number of drops onto the outer third of the lower conjunctival sac. The conjunctival sac is the area inside the lower lid. Hold the dropper 1 to 2 centimeters from above the sac, taking care to prevent the dropper from touching the eye.
If you are administering ointment, discard the first bead from the tube.
Hold the tube above the sac. Squeeze 2 centimeters, about 3/4 of an inch, of ointment from the tube, working outward.
Instruct the client to close the eyelids, but not to squeeze them shut. Closing the eye spreads the medication around the eye, while squeezing can cause injury or other interference.
For liquid medications, press firmly or have the client press firmly on the tear duct for at least 30 seconds. This prevents the medication from running out of the eye and down the duct. Clean the eyelids as needed, wiping gently from the inner corner of the eyelid to the outer corner. Assess responses immediately after administering the drops or ointment, and again after the medication should have acted.
Wash your hands thoroughly.
Document the medication administration. Observe the client's response to the medication, watching for any side effects according to the instructions given by the delegating RN. The next procedure we will cover is dressing changes for wounds.
As with any procedure, The first step is to evaluate the client. Talk to them about what you're going to do. Ask them how they're doing and determine if they are experiencing any changes in their condition.
Step 2 is prepare for the procedure. This is done by first reviewing the delegation instructions. You should then wash your hands thoroughly with soap and water. Take the time to dry your hands thoroughly as well.
Put on a fresh pair of gloves and perform the procedure as necessary.
First, remove the old dressing and dispose of it in an appropriate container. Remove your gloves, wash your hands, and put on a new pair of gloves. Cleanse the wound as directed by the delegating nurse.
Apply any ointment or medication, again according to the delegating RN's instruction. Apply a new dressing.
Finally, remove the gloves and wash your hands.
That's a lot of hand washing.
True, but we need to be very careful about spreading infection.
I've noticed my hands get really dried out from the gloves and so much hand washing, but using lotion every day seems to help.
The kinds with moisturizer really do the trick.
What should we be looking for when changing a dressing?
That's a good question. Documentation of wound observation is very important and should be detailed in the client record. You should document your observation of wounds as often as the delegating nurse requires. You should make notes of the client's general complaints and be aware if they are eating well and drinking plenty of fluids. After you clean the wound, you should observe the drainage and make notes about the color, any odor that persists, and the amount and consistency of the drainage. Look at the size of the wound and describe it as being close to the size of something familiar, such as a dime or quarter. You don't need to be exact. It's simply important to have a consistent measure. Identify the color of the wound and describe the wound edges as being circular or irregular in shape. You should always notify the nurse as soon as possible if there's an unusual change in the appearance of a wound.
That's all there is to it. It seems like a lot, but after a few times it goes like clockwork. What's next?
Glucometer or blood sugar testing.
For clients with diabetes.
Right. A glucometer is a machine that measures the sugar content of a person's blood. There are many different kinds of machines available, so be sure that you understand the one your client uses. And the first thing we always do?
Evaluate the client.
Right again. Find out how they're doing. You can ask them where they would like you to draw their drop of blood from. Obviously, you don't want to use a swollen or injured site, and it's a lot easier if the area is warm. Step 2, prepare for the procedure. Review the delegation instructions and wash your hands. Gather the equipment you need and put on a fresh pair of gloves.
Step 3, complete the procedure.
Puncture the skin as directed by the delegating RN. The best practice is to change the puncture site for each test. Perform the test according to the equipment you are using and instructions from the RN. Provide direct pressure to stop the bleeding if needed.
Remove the gloves and wash your hands.
Step 4 is to document the reading with the date and time and any other information required by the delegating RN. Step 5 is to observe the client for irritation of the puncture site. And that's all there is to it.
I remember it seemed kind of scary at first, but now it's pretty easy to do. I like to make sure I'm following the steps correctly, so I'm careful to review the delegation instructions every time.
That's a good idea, for safety's sake. The last procedure we're going to cover is gastrostomy feedings. A gastrostomy is an opening from the stomach to the outside, through the abdominal wall. This allows the person to receive food, fluids, or medications through the tube. There are 2 types of feeding tubes. One kind is the nasogastric, or NG tube, which reaches the stomach via the nose and esophagus. The second kind is a gastrostomy tube. This is inserted through the abdominal wall directly into the stomach. These tubes are called a variety of names and are surgically inserted, often under a local anesthetic. Eventually, the tube could be replaced by a Foley-type catheter or button.
When administering nutrition via a feeding tube, remember that this is the client's mealtime, so be sure to ask them about their preferences. Find out if they would like to be around other people or would like privacy. Be careful when moving, bathing, and dressing a client so that you don't pull on the tube.
Report any discomfort and watch for skin irritation around the abdominal insertion site.
Sometimes a client can have food in their mouth for taste, but are not allowed to swallow. If tasting is allowed, ask the client what foods they would like to taste.
You should notify the nurse if vomiting or a lot of burping occurs. Verify in writing with the delegating nurse the process for feeding, the amount of water, flow rate, and what position the client should be in when receiving liquid feedings.
While evaluating the client, explain what you're doing and ask them to tell you if they experience any discomfort.
Prepare for the procedure. Remove the dressing carefully. Don't use scissors because you might cut the tube. Complete the procedure as instructed by the delegating nurse. Anchor the tube. Flush the feeding tube with water before each feeding or administration of medication.
Administer the formula or medication.
Flush the feeding tube again.
Remove your gloves and wash up.
Step 4 is to document the feeding, and Step 5 is to observe the client for any complications.
I know these demonstrations are just to give us an example of tube feeding, but do you have any general tips and suggestions?
While each client is different, there are some pointers that you might find useful. Have the client sit upright or at a 30 to 45 degree angle while tube feeding and maintain this position for 1 hour after feeding has been finished. Observe the client's mouth for any signs of dryness or breakdown. Encourage them to brush and use mouthwash or other mouth freshening products like saline swabs.
Remember to have the client sitting up and tell them it's important to not swallow. You don't want them to choke.
Diarrhea can occur because of the dumping syndrome, a rapid emptying of the stomach contents into the small intestine. If your client has this problem, report it to your supervisor and the delegating RN. Keep things sanitized by always cleaning the equipment as directed.
With so much to think about and attend to, what are the most common complications we should be aware of?
Well, first, the obvious thing is that the tube accidentally comes out, or fluids from the stomach can drain out and irritate the skin around the site, or the tube may become plugged. You and the delegating nurse need to decide who should be called in the event that one of these complications should occur. Your client may have specific things the RN wants you to keep an eye out for.
That's it for the demonstrations.
Again, this video segment is meant only to provide you with some good practices suggestions for the most frequently delegated procedures. You need to go over your delegated procedures with your RN for each of the clients you work with.
More than anything, we want you to remember that procedures need to go according to an established plan. The first step being evaluate the client. Step 2, prepare for the procedure. Step 3, complete the procedure.
And steps 4 and 5, document and observe.
Congratulations, you've completed the video portion of this training.
Keep up the good work.